Hospitals Kolkata towards rendering more timely emergency medical services. And I would like to humbly request to all our friends from the press, if you're not holding the camera while we light the ceremonial lamp, we'll be expecting some applauses from the house. If you can do that, please.
একটু একসাথে সবাই একসাথে একটু করে নেবে না प्लीज सब एक साथ हाथ दे दीजिए ना একটু এদিকে দেখুন এই সামনে উড়িষ্যার তো আছে ভাই
Well, thank you so much. I think it's time we present.
Namaskar and good afternoon to all of you. I'd like to thank all of you for taking out time to come here for this occasion. This is a great occasion. This is the first time that we are launching, I think first time in India, that we are launching a 5G ambulance. It is a 5G-Connected ambulance where when a patient, as soon as the patient comes into the ambulance, when it gets into the ambulance, the treatment starts from there. We have monitors in the ambulance and we have a software that connects us to the main emergency of our hospital where doctors are there and they can monitor the patient from the emergency itself and instruct the doctor who's there in the ambulance to carry out whatever is required. And in this way, we can save the lives of many critical patients. So this is the first time in India that it is being launched and launched in Calcutta. So it's a great occasion. We have Dr. Hariprasad sir who will speak on this, and we have our emergency medicine Dr. Arijit Bose and our DMS. They will explain it further to you. Thank you once again.
নমস্কার, আপনার ইমার্জেন্সি তাপস স্পিকিং, হাউ মে হেল্প ইউ? নমস্কার ম্যাডাম, হ্যাঁ বলুন, আমি কিভাবে আপনাকে হেল্প করতে পারি? আচ্ছা, অ্যাম্বুলেন্স
Emergencies call for the highest level of alertness, precision, and efficiency. To ensure these, Apollo Multispeciality Hospitals is introducing its state-of-the-art 5G-Connected ambulance. India's first ever comprehensively designed 5G ambulance comes with the latest medical equipment, patient monitoring applications, and telemetry devices that transmit data regarding the patient's status to the hospital in real time. Onboard cameras along with body cams attached to paramedics relay instant information to a tele-emergency hub. This allows doctors to make faster and more accurate decisions while the patient is in transit and advise those in the ambulance on how to best administer the required aid.
No sir, no prior history.
So looking at the vital signs, he is not tachycardic, he is not hypoxic, and he is not tachycardic also. When you auscultate him, how is the chest?
Sir, chest there is left side decrease geriatry with crepitations associated with left side compared to right side. And heart sounds, he has no added sound.
Keeping the vital signs.
Long transit in ambulances has proven to increase mortality. But with the 5G-Connected ambulance, treatment begins when the patient is on their way to the hospital. Real-time data, including the patient's vitals and their movements, are supplied to the emergency room for optimal preparation to receive the patient. This significantly improves the nature of patient assessments and increases the chances of life-saving interventions.
Apollo Hospitals has always tried to provide access to the community. Apollo 5G connected ambulances use the advances in technology to provide immediate access to the seriously ill and injured. It enables advanced care from the spot where the patient is, through the journey to the hospital and in the emergency room of This is truly a path-breaking initiative and will be an important tool in saving precious lives.
Being here on this hot Friday afternoon, I'm extremely happy and proud to be here today, because way back in 1996, the journey of starting emergency medicine began, and I was extremely fortunate to be a part of it. Before that, ambulances were mainly used to carry dead bodies back from hospitals or to the mortuaries they were not equipped, they were just vans. That's when we as a group, under the guidance of our chairman Dr. Reddy, said we will start emergency medicine as a specialty in this country. And we did not have an ambulance manufacturer who could give us an ambulance which was fit enough to actually carry the seriously injured or the ill. So we actually sat with the fabricator and designed the ambulance and created the first ambulance which was capable of handling a seriously ill or injured patient. Then we realized that we did not have the people to be in the ambulance, because there was no training program for emergency paramedics at that point of time. So we as doctors got into the ambulances and actually started shifting patients, and that's how the entire journey began. And why is this important? In emergency, either for the seriously injured or critically ill patient, the first hour is known as the golden hour. The reason being, the quality of care that is provided during the golden hour very often makes the difference between life and death. And as you would all imagine, majority of accidents and emergencies, almost all of them, happen outside a hospital setting. They don't happen in hospitals. And a significant part, or almost the entire time of the golden hour, is lost in the patient actually being brought to a hospital. If the patient is brought to the hospital during the golden hour, the options of getting the patient back to normal are significantly higher. I'll give you an example. If a patient has a stroke and reaches the hospital in time, during the window period for stroke, then the hospital, whether it is with a radiological intervention or with medicines, is able to lyse the clot which is causing that stroke, and very soon the patient is back to normal. If they don't reach within that window period, the clot buster therapy is not possible. So the patient has some remnant amount of paralysis or some disability for the rest of his or her life. Similar is the case of a heart attack. Similar is the case of a patient who's had an accident and is bleeding. Or similar is a scenario for a patient who's had an accident and has a head injury. So significant part of the golden hour is spent outside the hospital, and that is really impacting the outcomes of these patients when they fall seriously ill or injured. So we initially started this ambulance service with what was available at that point of time. We started training paramedics, and we were the first hospital group to get a 4-digit number for easy remembrance during an emergency. That's a 1066. And I think we continue to be the only private hospital group to have this number across the country for emergencies. Now, as things improve, we need to understand the technological improvement, the human resource improvement. Today we are in a position to actually begin the treatment at the spot where the patient is. And a combination of factors have led to this. One is significantly improved connectivity with the 5G technology. That's the first thing which has helped us do this. The second thing which has helped us do this is what, in your words, is the telemedicine. We've been doing telemedicine for many years, where from point to point a patient could talk to a doctor. But today we are using the telemedicine technology in an enhanced manner, where the patient at the site, in the ambulance, through the journey to the emergency of the hospital, is actually having a emergency physician treating the patient all through. So what connectivity of 5G with the technology of telemedicine, EICU, e-emergency, and the skill of the emergency physicians, we are suddenly able to transform the golden hour into a really useful, purposeful, and beneficial time for the critically ill and the injured. I think this is a significant development, and I travel the world and I can vouch that most of the world does not have access to this sort of a emergency system. And I'm very glad that Calcutta is launching it for the first time in this country, and it's only going to be a beginning where many others would come up. Like when we started the ambulance system, then the government took it over and started the 108 system across the country. Similarly, we are hoping that once we launch this, many others would take this up, and millions of people who would have otherwise suffered during the golden hour would benefit from this technology. So the important thing to remember here is, it's not about the technology, it's not about the connectivity, it is about the patient. We are able to make a huge difference to a patient who is critically injured at home, at work, wherever, on the road, wherever, or has a heart attack in the house in the middle of the night, or has a stroke at the workplace while he's still working. We are able to make a huge difference for that patient. I think that's what the message needs to go to the common man, and to make sure that it is used to the maximum. I'm extremely happy to tell you all and also announce that these services would be free of cost within the city limits of Calcutta. That means anybody, irrespective of what their capability of payment or no payment, can access quality emergency services in the city of Calcutta free of cost. What we would be charging for is only because the treatment starts from where the patient is. If any drugs or disposables are used, only that cost will be recovered from the patient, but the actual service would not be recovered from the patient. The hospital is providing the technology and the ambulance, and the doctors in the hospital are providing free consultation or free guidance during the entire journey. So Calcutta is probably the first city in the country to have access to this sort of a service at no cost, which I believe is a big thing in bridging the gap between a critically injured patient and quality emergency care. So I would like to request you to carry this message across to the common man in a big way, because one of the common problems we see is awareness in an emergency. People tend to take it, if somebody is having chest pain, they think it is a gastritis and wait for it to settle down. In the meanwhile, precious time is lost while the heart is getting injured. Similarly in a stroke, similarly in an accident. When there is any symptom of an emergency, impeding emergency, please access emergency services and seek help immediately. That actually not only saves the life, but gets you back to normal at the earliest. So thank you very much for being here, and this is just the beginning, and we will ensure that more ambulances are available in this city, and we actually take it across all our locations across the country wherever we are present. Thank you very much.
CEO, ladies and gentlemen, audience and the press at Calcutta. I welcome you all here, and I think it is a very momentous occasion for all of us. The very fact that Dr. Hari Prasad, President of Apollo Group, is here with us, it indicates the importance of this launch today. Maybe a small step of Apollo will be a giant leap for healthcare in the future. So we welcome you all here. All I would like to add to what has already been stated is that this small jump that we have taken is based on a huge technological advance of the 5th generation of communications, which we as a Apollo Hospital group, we are committed to bringing excellence in healthcare, healthcare of international standards to the people at their doorstep, which is the mission for Apollo Hospital under the tutelage of Dr. Pratap Reddy, our chairman. We also have our vision to touch 1 billion lives. I think we have the opportunity with an ambulance service of this nature, which I would acknowledge that this ambulance service and the emergency medicine, which has begun through Dr. Hari Prasad, who is an emergency physician by profession. So we take this opportunity to take his guidance and your ability to spread this message of this giant leap in healthcare that the 5G ambulance will provide to this new 5th generation, new radio technology in the future.